It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events. And get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone, and welcome to this week's episode of Morton in the Morning. Happy February. And certainly the topic that everyone is talking about this week is the blizzard that we had over the weekend. We hope everyone in our community was safe and dug out of the snow safely. It was certainly a lot of snow, and hopefully you didn't have to come to the hospital during that storm. But if you did, hopefully our team provided you with great care. And speaking of our team, we certainly want to give a huge shout out to them. It's never easy, coming into work when there's a storm of this size. But our team is outstanding, and they rallied, and we had many of our staff members who came in early to make sure that they would make it in time, or stayed to help out if there were any staff members who were unable to come in. So they were here to make sure that our patients were well taken care of throughout the storm. So we want to give a huge shout out to our incredible team who always comes together during these difficult times. We appreciate you so much for all that you do. Thank you so much for all that you did during the storm. So on today's show, we wanted to introduce you to one of our off-site services up at Northwoods Medical Center, and that is our Outpatient Rehabilitation Services Department, as well as our Speech, Hearing, and Language Center. Both are located right up there at Northwoods Medical Center on Bay Street. And our physical therapy team at our outpatient rehab department, as you know, recently won Best Physical Therapy and the 2021 Best of the Best Community Choice Awards. So we are so excited about that. So we are going to talk and learn a little bit more about the services offered at those two sites. And then toward the end of the show, we'll give you some updates on upcoming events and new doctors here at Morton Hospital. But let's get right into our interview with today's guests. Okay, so our guests for today are Deb and Lori, who work at our Northwoods Outpatient Rehabilitation Services Center, and they also support the inpatient physical therapy needs and the team here at the hospital. So thank you, Deb and Lori, for being here.
It's a pleasure to be here.
It's wonderful to be here.
Okay, great. Well, let's hear you tell a bit about yourselves to the listeners.
So, I was at Morton Hospital for about 26 years, spent a lot of my early years clinically here. I left for a little bit of time and was experiencing long-term care. I came back last September, and I'm delighted to be back in Taunton. And I am the rehab manager. I oversee the inpatient and the outpatient rehab services.
Okay, great. And Lori?
Well, I have been here at Morton for just about 30 years.
Wow.
Mostly I have been working in the outpatient setting. I have an orthopedic specialty. However, I treat other conditions also. I originally attended University of Lowell. I received my bachelor's degree in 1987 and then went on to graduate school at the Mass General Hospital Institute of Health Professions, where I received my master's in orthopedics and then a doctorate's.
Wonderful. Wow. So how did each of you decide to get into the field of physical therapy or rehabilitative medicine?
So for me, it was at about age 14, seeing the movie The Other Side of the Mountain, in which Jill Kinmont was a skier going into the Olympics, sustained a spinal cord injury, and that really became something I was very interested in. So I did actually start that way, doing spinal cords, went into sports, did a little pediatrics, a little industrial medicine. Fortunately, my training at Quinnipiac College, now university, did give us a little bit of everything. So I was able to jump around and do different venues of service. So And here I am, 30
Okay, well,
years
glad
later.
to have you. I found it pretty unique, I think, to know what you want to do at that age. That's great.
Right, yes.
Okay, and how about you, Lori?
Well, when I was in about 7th or 8th grade, my uncle suffered a cerebral aneurysm, and he was in long-term care up at Braintree Rehab, and so we used to go visit him almost on a daily basis, and I saw a lot of physical therapy and taking place, and it was fascinating to me to see what was involved, and I think that settled back in my brain, and it must have reemerged at some other time, and one day I just woke up and I said, that's what I'm going to be. I'm going to be a physical therapist. It kind of came to me later on.
That's great. So you were both inspired by something at a young age, and I'm sure that has translated into you both being very passionate about your work. So wonderful.
And interestingly, Lori was a student with us when she was in college, and we then recruited her to stay, and she's been here
For 30
Almost
years.
30 years.
Wow.
Almost 30, yeah.
Well, congratulations. So let's talk a little bit about all of the rehabilitative services that Morton Hospital offers. So let's start with, our off-site facility at Northwoods, and then maybe talk a little bit about the inpatient services as well.
Okay. At Northwoods, we have a suite of physical and occupational therapy. We also have speech and audiology. So
All right.
Mickey will speak more about the speech department. The audiology department is unique in that we service both adults and children. We see babies as young as newborns to have something called ABRs, which are hearing tests for newborn babies. All babies born in Massachusetts are required by law to have hearing screenings in the hospital. If they fail them, which sometimes they do because of fluid in the ears, they will come to Morton or some other facility, but Morton is the one in the area, and they have testing done. And if there is a hearing impairment, there can be hearing aids prescribed. They are prescribed for tiny little infants, or it may just be something that we watch them for a while.
Okay.
The PT and OT side, Lori actually works on that outpatient side. I'll let her talk more about PT and the OT involvement also.
At the Northwoods facility, we see occupational therapy and physical therapy conditions. We have a beautiful site, a very large gym. We treat everyone from children to geriatrics, athletes and non-athletes alike.
Okay. And talk a little bit, so you are a physical therapist,
Yes.
correct? So who else makes up the rehab services team at the offsite facility?
We have physical therapists, physical therapy assistants, a physical therapy rehab aide, and occupational therapists.
On the speech side, we have speech and language pathologist and audiologist. One of the other outpatient programs we have, which is actually situated at the hospital, is our pulmonary rehab program.
Okay.
So we do see patients with pulmonary diseases who are referred by their physician, some of them by their pulmonologist, and we teach them how to pace themselves. We get them doing some energy conservation techniques. We have them do some exercise so that they can either wean off oxygen or wean down in oxygen, and just enjoy life a little bit more fully because they can do a little bit more.
Okay, so it sounds like a full range of rehabilitative services are available. So talk about some of the more common conditions that you see at the Northwoods facility.
Okay, so commonly we'll see post-surgical conditions such as total knee replacements, total hip replacements, total shoulder replacements, rotator cuff repairs, and also other orthopedic painful conditions such as tendinitises and arthritis. We treat neck pain, back pain, We have our OTs will also work on hand, wrist, elbow injuries. They can fabricate splints. We treat stroke patients.
Okay.
We've had amputees, and we've had neurological conditions such as Parkinson's and MS.
Okay. And do you treat the full range of different ages?
I tend to treat adolescent through geriatric.
Okay. But the center as a whole does provide services for all ages?
We have a therapist who will treat infants
Oh, wow.
for conditions such as torticollis.
Okay.
We see just about everybody.
Okay, great. Well, I have plenty more questions for you, but first we need to take a quick commercial break. So to our listeners, hang in there. We'll be right back with more Morton in the Morning to learn about the Outpatient Rehabilitation Services Department at Northwoods Medical Center affiliated with Morton Hospital. We'll be right back.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
From all of us at Morton Hospital, thank you to our community for voting for us in the 2021 Best of the Best Community Choice Awards. We're honored to have been voted Best Hospital, Best Audiologist, Best Hearing Aid Center, Best Physical Therapy, and Best Weight Loss Center in the Metro South region. Learn more about our services and quality achievements at mortonhospital.org and follow us on Facebook to stay up to date on what's happening at your award-winning community hospital.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Welcome back to Morton in the Morning. I'm Julie with Morton Hospital, and I'm sitting here with Deb and Lori from our Rehabilitation Services team. We're learning about the services up at Northwoods Medical Center in our Outpatient Rehabilitation Services Department, and a little bit about the conditions that you treat, the range of ages that you treat. And what you mentioned OT, so what exactly is the difference between physical and occupational therapy?
So in the settings that we are working in, we tend to think of physical therapy as working with gross motor, the big muscle groups. Things like walking, climbing stairs, getting in and out of bed, in and out of a chair. Occupational therapists deal more with smaller muscle, fine motor, more of your hand and your fingers, upper extremity disability. Both areas overlap in both disciplines overlap in some areas. We both treat pain. We both use modalities. Occupational therapists do a lot of splinting for hand injuries, hand surgeries. Physical therapists deal with more industrial accidents, work conditioning, endurance, big muscle activities, so that people returning back to sports, bringing back to work, would be more seen by physical therapy,
Okay.
with some overlap with occupational therapy.
Okay, and just so we cover the full spectrum, can you talk a little bit about what types of rehabilitative services are offered here on site at the hospital for inpatients who need those types of services?
So the inpatient team consists of physical therapy, occupational therapy, and speech.
Okay.
The PT is really working on how do we get a patient to go home. Everything that you do when you get up in the morning, get out of bed, be able to get to the bathroom, get to the kitchen, physical therapists will work on. They'll work on what we call range of motion, strength, anything you need to be able to do those activities. Occupational therapy really focuses on your activities of daily living. Can you brush your teeth? Can you brush your hair? Can you make a meal? Can you feed yourself? And we do work together on a lot of that. Speech works on, can a person speak? If they've had a stroke, sometimes they have difficulty expressing themselves. They also work very, very heavily on the inpatient side on swallowing. So just as people have weakness in musculature and might have difficulty getting from sitting to standing. They also become weak in swallowing, the muscles that help with that. So they will work on assisting people and modifying their diet so that they can swallow safely.
Okay, that's great. And what are, in general, some of the benefits of physical therapy?
Well, I feel that the most important benefit and the thing I enjoy most is educating my patients. And education is so important that I think a patient who knows about anatomy and posture and ergonomics and why are they really doing these exercises, they'll be more compliant and they'll get better faster, and they'll learn things that they can live with for a lifetime. So I think primarily the benefit of physical therapy is learning how to take care of your body for a lifetime.
And it's interesting that you brought up ergonomics, because oftentimes you think of physical therapy as a treatment for if you have an injury, but ergonomics is really more preventative, isn't that correct? And really that can apply to anyone who works in an office setting or just anyone in general, the way you should be sitting at home or your posture, is that right?
Yeah, sometimes I think I sound like my mother when I stress the benefits of, sitting up straight, proper posture. It really, sometimes you don't only get injured from movement and lifting. Sometimes you can get injured just from sitting too long and sitting incorrectly. It can work, can be a toll on your body.
Sure. And are there other ways that physical therapy can also be used as a preventative method versus just a treatment method?
Yes, because I think with education, you can learn, like I just mentioned, posture, ergonomics, but also a stretching program, a home exercise program, also proper ways of lifting and transferring and movement so that it will prevent further re-injury.
Okay, and how important is stretching for injury prevention?
Oh, I think it's very, very important because your body works much more efficiently if it's flexible and if there's less strain on the joints.
Okay.
So we'll actually our bodies will maybe last longer if we take care of them.
Okay, and one of the sayings that I always remember, if I'm lifting something heavy is lift with your knees, not your back. Is that still correct?
Yes, your large muscles of your legs are made for power. But you also have to engage your core muscles too. And I think the core is now a very common buzzword. But yes, you have to engage your core to protect your spine.
Okay. And so if someone believes that they need physical therapy, what are the steps they need to take to start receiving care at our outpatient center?
So you need to start with your physician and talk to your physician. They need to write a referral. And you can call us at 828-7265 for physical therapy and occupational therapy. And we can set up an appointment where you'll be assessed by a clinician and they will determine your plan of care. And that will be determined on the problems they find, what your particular goals are, and determine what works best for you. And it will probably be a combination of home exercises, some in-clinic time, and a lot of education.
Okay, and on average, what's the frequency of visits? How long do you typically see someone? Does it vary by injury or ailment?
It does vary. It does. Usually 2 times a week is nice because it's not overkill. It's enough that it gives them time to exercise on their own, come in, learn a little bit more. Probably on an average, we see people between 4 to 8 weeks, but depends. It's so varied.
Okay. And you mentioned, the teaching component, and I'm sure that you do. You mentioned having patients exercise on their own. So do you provide those instructions? Do you teach them on techniques that they can do on their own?
Absolutely. And we'll provide a written home exercise program just so that they can remember the exercises when they get home.
Okay. And aside from the initial referral, how do you work with the patient's primary provider? And are there other specialists that you often work closely with as well during the patient's treatment plan?
So on the inpatient side, we are always in contact with the case managers, who are nurses and social workers, who are developing the plan with us and the physicians as to where the patient will go to or what kind of services they'll need once they leave the inpatient side. We do round with the hospitalist on a daily basis so that we can discuss what our thoughts are, where we think the patient needs to go, what kind of services they need to provide. We also have, through Steward, we do look at high-risk patients and do collaborate with some nursing people who provide services out in the community to discuss what these patients' needs are and to ensure that they have the services, the equipment, everything that they need so that it can be a safe discharge home.
So in outpatient, we communicate with the physicians by sending them a copy of the initial physical therapy evaluation, which outlines the PT plan of care. And then on a monthly basis, we'll send a progress report, or even sooner if need be. But we're always in contact with the doctor. If the patient requires a specific post-operative protocol, I contact the physician and make sure I have a copy of that so I can follow what the physician requires.
So a lot of collaboration goes on.
Absolutely.
And personalization for each patient. So here's a fun question. Is there anything unique or innovative happening in the field of physical therapy or rehabilitative medicine? Any unique new treatment options?
There's always studies that are ongoing and different techniques, a lot of manual therapies that are being developed and therapists trained around the country, around the world. A lot of for pain management. I think now at this point, as we are kind of on the downtrend at this point for COVID patients, we saw so many COVID patients at Morton Hospital during the last few months. Mm-hmm. The strength that they lost while they were ill was something that we were certainly not prepared for. As a physical therapist with 35 years of experience, I don't think I've ever seen patients that debilitated. So there are a lot of studies and a lot of literature that's coming out now. It's what I've been spending most of my time looking at on what happens to these patients, why it happens, and how do we get them stronger again. Mm-hmm. So that really will be something that will be significantly in the literature for rehab medicine, I think for the coming months and years maybe.
Okay. And just in general, is there anything else you'd like to share with the community about the services you offer?
I think that our outpatient department is very unique. It's off-site. It's about 5 miles away from the hospital, right off the highway. It's easy to access. There's lots of parking. The therapists are very skilled. Many of them have been with us for many years. We have a lot of equipment, new equipment, a lot of space, very enthusiastic staff who are constantly trying to do new techniques, trying to get patients better, and work very well together so that they can collaborate. If they have a patient who they're having difficulty getting to a certain goal status, they can talk to each other, bring each other in, and to help.
Okay. And I know we get a lot of positive patient comments about the whole team, so kudos to everyone for that. And so just so everyone knows, describe exactly where your facility is located. I know it's very convenient off the highway, but whereabouts would people see it? Maybe if they don't know where it is, and then one day they're driving by and they might be prompted to be like, oh, there it is.
We are at 2005 Bay Street in Taunton.
Okay.
We're right at the outside of the industrial park. We're near BJ's. There's a little shopping center there, so we're right in front of BJ's. It's right off 495.
Okay.
Bay Street exit off 495.
Okay, great. Well, I appreciate you both spending the time today. Like you had said, Deb, if someone wants to learn more, if someone wants to call for an appointment, they can call 508-828-7265. Is that the right number?
That is correct.
All right. Or there's information about our rehabilitative services on our website as well. So appreciate you both. Thank you for all you do and for the great information.
Thank you very much
Thank you
for
very
having
much,
us.
Julie.
Okay. Another great thing about our outpatient rehab services department is they offer very convenient hours. So physical and occupational therapy is open Monday through Friday from 7 a.m. to 7:30 p.m. So that's very convenient to accommodate anyone who might want to come in to their appointment before work, after work, or before and after any activities that they have going on throughout the day. So we're going to take another break. We hope this segment was informative. When we get back, we're going to learn more about another one of our outpatient services, and it's a very unique and special service line. It's our Speech, Hearing, and Language Center. So stay with us, and we'll be right back in just a few minutes.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Morton Hospital's nationally accredited Center for Weight Control has grown with the addition of Dr. Deepthi De Silva, our new Director of Medical Weight Loss Management. Our center now offers high-quality medical and surgical weight loss options close to home, with medical weight loss appointments now available in Taunton and Middleborough. To learn if you qualify for weight loss surgery or medical weight loss and to schedule a consultation, call our Center for Weight Control at 508-301-2434.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Welcome back to more Morton in the Morning. We hope you enjoyed hearing about our Outpatient Rehabilitation Services Department. So now we are joined by Mickey Mitchell, who is our Speech Pathology Supervisor at our Speech, Hearing, and Language Center at Northwoods Medical Center. So thank you for being here, Mickey.
Oh, my pleasure.
Okay, tell us a bit about yourself and your background.
I've been a speech pathologist for 35 years.
Okay.
It's been a very long time. And I've been actually at Morton Hospital for 32 years. Of that, I decided to become a speech pathologist. When I was in high school, I really knew nothing about the field, but I wanted to be in a helping profession. And I definitely wanted to go into something that did not require too much math.
Okay.
So that's how I chose my field.
I don't blame you there. So what specifically about speech therapy interested you?
I wanted to be able to work with children and adults and to be able to make their lives better, to be able to make a difference in their day-to-day living. And when you think about communication, talking, listening, speaking, reading, that's what humans are uniquely designed to do. That's what differentiates us from other creatures in the animal species. Okay. So it's really something that you don't realize the impact until you don't have it or there's a problem. And so that I felt was really a way to connect with individuals and also, again, to make their lives better.
Okay, wonderful. So earlier in the program, we were speaking with Deb and Lori about the rehab services at Northwoods, and the Speech, Hearing, and Language Center is up at the same building. So can you talk about, provide an overview of the types of services that you provide at the center?
Sure. We are very lucky to be able to provide services to all age groups, from infants through geriatrics. And we also provide a range of services in speech language pathology. We're able to offer language therapy, speech therapy, therapy for children who have developmental disabilities or autism, stuttering, people with voice disorders, whether it be a paralyzed vocal cord or perhaps growths on their vocal cords. We are able to work with pediatric and adult patients with swallowing difficulties. So we really provide the full range of services in the area of speech pathology.
Okay, great. And that's not just on the outpatient setting. You also provide those services for patients in the hospital. Is that correct?
Correct. So we do provide inpatient acute care services. Most of the patients we see in the hospital are patients with swallowing disorders, but we also see patients who may have suffered a stroke or a brain injury and require some work with language and speech as well.
Okay. And so in your outpatient clinic, what are some of the more common disorders that you're able to help diagnose and treat?
We work primarily with pediatric patients. It just happens to be the patients who typically get referred to our center. And we see children with speech disorders of articulation, children with speech sound errors. We also see children who don't understand language as they should or speak in sentences. That's the language portion. We tend to see a greater number of children year after year with autism. We also work with children with syndromes, with Down syndrome or other unique syndromes, children who may have cleft palates, children who may have other types of developmental disabilities, and also children with learning disabilities. So any child with a speech or language disorder typically can be seen by our skilled therapists.
Okay, wonderful. And when you're treating children, I would imagine that you would need to get the parents or the guardian, the families involved. How do you incorporate them into the care plan?
That is absolutely 100% the focus of our type of treatment. We see patients one-to-one, one therapist, one child. So the child gets to work directly with the therapist, one child, and within the treatment setting, we have observation rooms. And this is where the parents get to observe everything going on in the session. We want them to see what we're doing. We want them to see how their child is responding, and then that allows them to continue to work with that child at home. We always have a home education plan that is part of the program, and the family completes homework assignments and activities at home. They come back week after week, report on how the child is doing. So it's not just twice a week for 40 minutes that the child's getting therapy. They're really getting it throughout the week, which not only enhances their progress, but also keeps the family directly involved, which is really important.
Okay. So I would imagine there's a lot of education involved. So you do a lot of that with the families so that they can bring, like you said, the care plan home and do those exercises.
Absolutely. Lots of education, and not even just for the parents themselves. Sometimes we have grandparents involved. Sometimes we have babysitters and nannies. Anybody who spends a fair amount of time with that child week to week, we want them to be involved in the care plan, because then they will facilitate carryover, which overall really enhances the child's progress.
Okay, great. So for the parents out there that may be listening, or grandparents or nannies or anyone that you mentioned, what are some of the common signs or symptoms that they should watch out for that might be indicative of a speech or language disorder in a child?
Sure. One of the things that I always encourage parents to respond to are their own concerns. We know that if a child is, for example, 2 years old and they're not saying words, that's a concern. If a child is 3 years old and it's extremely difficult to understand, even by family members, that's a concern. If the child is having trouble following directions, understanding questions, that's a concern. But I find that parents really know innately what their child should be doing, and I always recommend that if they have any concerns at all, it's better to bring them in, get them evaluated. If we find that the child really is functioning within normal limits, great, good news. If not, then we can immediately come up with a set of recommendations and a plan for what would be best for that child, and get that child right into treatment and start working on those difficulties right away. So parents, I think, really know when they need to bring their child in. But those are some examples.
Yeah. So almost, if something just doesn't seem right.
Doesn't seem right,
okay.
Exactly. And we have a wonderful network of pediatricians in the community that refer these children, and they listen to the parents' concerns. They also share their concerns, and they're very proactive at getting those kids in nice and early.
Okay. And so you mentioned that you receive primarily or, majority pediatric patients.
Correct.
But when you do see adult patients, what types of things do you treat them for?
Sure. So we see patients who have had strokes or brain injuries who have a specific type of disorder called aphasia, and that is a language difficulty that's a result of a brain injury. Some of these patients can't speak well, they can't form sentences, they have difficulty formulating the speech sounds that are required to speak clearly. Some of them have memory and other sorts of related cognitive issues that impact their language and their communication. We also see patients who have swallowing disorders, perhaps from a lengthy illness or from Parkinson's. Also, again, patients who have had strokes do sometimes have muscle weakness that impacts their swallowing. We see patients who have voice disorders, people who may have been intubated for surgery and now have a vocal cord paralysis, patients who have what we call muscle tension dysphonia, where they use too much muscle tension and it impacts their ability to produce a clear and appropriate sounding voice. They have trouble with breathing. We see patients whose speech and voice are impacted by breathing dysregulation. So really, there's a range.
Wow, that's amazing. It sounds like you definitely have some incredible programs, and I'm glad that we have this opportunity to spread the word about what you have to offer. It's good for the community to know that this resource is here. Mm-hmm. So are there any plans to grow your services or introduce new programs?
We are always looking to introduce new programs. We have begun to work on a program called Speak Out and the Loud Crowd. And this is specifically a program for patients with Parkinson's, which enables them to be more effective communicators and to be able to allow their voices to be heard. With Parkinson's, patients tend to use a very soft voice and they have trouble with volume. And in this program, there are exercises where the patient learns to speak with intention and to speak out loudly and to project their voice. Unfortunately, right now, given the state with COVID, we don't want patients to be projecting their voice because of the potential of spreading a virus. Sure. So we're really hoping that once the virus is under control and there's a vaccine, we can begin this program because we have therapists trained and ready to go.
And there's a need for that type of program.
There is absolutely a need for that kind of program. I think this is a very underserved population, I think, all over the state of Massachusetts, and certainly we can provide this wonderful evidence-based program to help them.
Wonderful. Well, that's really exciting. I hope that does come to fruition when it makes sense to do so, when
Absolutely.
It's safe to do so.
Absolutely.
So what would you say is the best part about your job?
That's hard because every part is the best part. I really love working with the patients and the families directly. I love the interaction. I love the education piece. I love the fact that the parents and the spouses are directly involved, that the patients progress at such a wonderful pace, that it's one-to-one, it's individual, and we can really see the progress and we can really see ourselves making a difference. Okay. And that's what I love about it.
Okay, sounds like a very rewarding field for sure.
Very much so.
Can you talk a little bit about, your team, what professions are involved and what makes them unique?
My team are speech pathologists who have their master's degree in many, many years of continuing education in varied programs and practices. Over the years. I have a very seasoned team. Most of my staff have been with us for 15 or more years, which is great. They know the community. They work very well together, not only within the department, but also with physical therapists, occupational therapists. Many of our patients see other professionals, other therapists, and so we like to work directly with them as well, the physicians, teachers, if we're working with children, so they're all part of the team. They are really just a great group of professionals who also love what they do, and is evident when you meet them and see them at work.
Well, that's great. It's definitely important to have an amazing team that's very passionate about what they do so that it comes through to the patients when they're being cared for. So thank you for sharing. We will actually be right back with more with you, Mickey. We just need to take one final break in today's show. So stick around and we'll be right back with more in Morton in the Morning to learn a bit more about the services at our Speech, Hearing, and Language Center.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
From all of us at Morton Hospital, thank you to our community for voting for us in the 2021 Best of the Best Community Choice Awards. We're honored to have been voted Best Hospital, Best Audiologist, Best Hearing Aid Center, Best Physical Therapy, and Best Weight Loss Center in the Metro South region. Learn more about our services and quality achievements at mortonhospital.org and follow us on Facebook to stay up to date on what's happening at your award-winning community hospital.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Welcome back to the final segment of today's Morton in the Morning show. I'm Julie, and I'm sitting here with Mickey Mitchell, our speech pathology supervisor at our Speech, Hearing, and Language Center. So we've been learning a bit more about the services available at our center, about the team, and a bit about the range of patients that you provide care to. Thinking ahead, I know you said you're always interested in introducing new programs to the community. Where do you see the profession of speech therapy 10 years from now?
I see us continuing to grow in a lot of different areas. People are always going to need this type of service. They're always going to need speech and language, swallowing services, and I think as the evidence grows for different types of swallowing programs, speech and language programs, I think that we're going to continue to be able to provide a greater variety of programs. And also, I think in the future, we will expand to teletherapy, which was something that a lot of speech pathologists across the country were able to do during the COVID crisis, so they wouldn't need to see patients in person, but could still provide those services. I think that's an important area that now, having been through this experience and knowing what is available through the internet and the computerized services available, that might be something we can expand into as well. There may be patients who just can't get to the center, and this would enable more people to access our services.
Yeah, that's really interesting, actually, because a couple of the shows that we've done so far, we've spoken to various providers, and they've talked about the fact that there are many benefits to telehealth, and also that it removes a lot of the barriers for patients, transportation, etc., childcare. So that would be interesting to see if your field goes in that direction as well. So what is the most important piece of advice that you give to your patients when you're treating them, whether it's, the parents of the kids or if it's adults?
I really have them focus on appreciating every little bit of progress. I think it's really important to focus on the positive and to always look back and say, this is where you were a month ago and now you're here. Look at all the things you can do now, instead of focusing on, well, I still might not be able to say this word or speak in this sentence. I really want them to focus on the positive and to be, fully part of the process and appreciating everything that their communication does for them, their family, and the community.
Yeah, so keeping them motivated. I'm sure it's a lot of hard work, actually. And when patients, go to your clinic, how frequently do they go? What is the typical, care plan, the length of time?
Typically, we see patients twice a week. We have found, and research shows, that if they only come once a week, they don't progress as quickly. And then if they miss a visit, they then get set back a little bit. We like to see most patients twice a week. Depending on the patient's disorder, the length of stay can vary. Sometimes it's as short as 3 to 6 months. Sometimes we see patients for a year or two. The goal is not to keep people in our department coming for years and years. We are not a long-term care facility. We want to work on the most functional skills and to get them up and running, so to speak, so that they can continue their services in a less restrictive environment. So for pediatrics, that would be within their school. Most children we see also get school services, and so we want to get them to the point where they can benefit more from their school services and continue there. And with adults, it could be just continuing with a home program and working on their skills within their functional environments.
Okay, so let's talk about how patients are able to be seen at the clinic. Can they call the center directly? Do they need a referral?
Patients can call the center directly, but we do need a medical order from their primary care physician in order to initially complete an evaluation. And this allows us to know exactly what the patient is struggling with, what their deficits are, and where we need to focus the treatment program. Once the evaluation is completed, we're able to make recommendations as to how many times per week and what specific goals to work on. So we need to complete that initial evaluation, and then we go from there.
And just curious, because it sounds like, again, some incredible programs that you offer there. Are speech therapy programs pretty unique, or do most hospitals have those types of programs?
In fact, most hospitals don't have those programs.
Okay.
We have a very unique outpatient clinic. Most hospitals do provide acute care therapy and services for their inpatients, but many do not have an outpatient clinic. The ones that do often are part-time, and they typically service adult patients for short periods of time. To have a large pediatric outpatient clinic is very unique, and that's one of the things that makes this center unique in and of itself, is that we have this center of excellence that has been open for, I think it's been at least 44 years. Wow. Maybe. I know it started, I think, in the late 70s. I don't know the exact year, but it's been a department that is known certainly to the pediatricians in the area, and becoming more and more known to the residents of the communities.
I mean, I've been here at Morton Hospital for 11 and a half years now, and in doing this show and the few show segments that we've done so far, I've learned so much and really some interesting facts about the amazing services. And it's pretty unique to have a community hospital that has these unique services that have been around for years. So I think this is wonderful. Thank you.
Yeah.
And is there anything else about the center or the services that you offer that you would like the community to know in closing?
I would just say anybody who wants to know more can contact us. We are happy to give them all the information they request when it is appropriate, given the state of the current virus. We're happy to give people tours. You can come by and see our center if you wanted to meet a therapist and just see what it's all about. We welcome that. We really do. I think most people who come into the center, having never experienced it, are always very pleasantly surprised at the physical facility, the level of quality, the therapist's enthusiasm, and I think it's always good to see that. And that just helps spread the word as well.
Okay, great. Well, thank you so much. This was very informative. So if patients do want to learn more about the center, the number to call is
508-823-3050.
Okay, excellent. And of course, we also have more information about those services on our website, mortonhospital.org. So, Mickey, thank you again for being here and for sharing with us.
My pleasure.
Have a good day.
Thank you.
All right. Well, that wraps up today's show. 2 great services available in our community for your rehabilitative or speech and language needs. They've certainly been around for a long time with long-standing and passionate staff. So good to know they're here for you if and when you need them. So to recap, you can learn more about both services on our website, which is mortonhospital.org. But if you'd like to call and speak with a member of one of these teams, you can reach our Outpatient Rehabilitation Services Department at 508-828-7265. and our Speech, Hearing, and Language Center at 508-823-3050. So we have a few minutes left in our show, so we'll share a few shout outs and updates. So first, again, thank you to everyone who attended our virtual hiring event last week. We had RNs, CNAs, mental health associates, phlebotomists, security guards, and many more who signed up. And we did several interviews, so we're hoping to welcome some of those members to our team very soon. If you missed our hiring event, you could still apply for any jobs at any time online on our website at jobs.steward.org. We still have a number of open vacancies in both clinical and non-clinical areas. So take a look. It's a great team. If you want to join us, we are looking forward to continuing to grow our Morton team in the weeks to come. Another shout out, this week we actually participated in the Bristol North EMS Virtual EMS Conference. And at that conference, Morton Hospital and a few other hospitals in the region presented Lifesaver Awards to some of our wonderful EMS professionals in the community. And here at Morton Hospital, we recognized 4 providers from Brewster Ambulance Service. We recognized Aaron, Jen, Lisa, and Laura from the Brewster Ambulance team, and there was a really great story about how they went above and beyond to save a local resident who was choking at home, became unresponsive, went into cardiac arrest, and they fortunately were able to successfully resuscitate this person and reunite the individual with their family. So shout out to those Brewster providers. It was an honor for us today to recognize you and thank you for the life-saving work that you do every day in our community. So winter is always pretty dreary, so at Morton Hospital we're always coming up with some fun activities and special treats to share with our staff just to thank them for all of their hard work. This week we had a pancake breakfast for our staff, so free pancakes. We had that early morning on Tuesday, yesterday morning, starting at 6:30 a.m. and did that for our overnight and first shift staff members. We also visited some of our departments to recognize them in person for the recent Best of the Best Community Choice Awards that we were the recipients of for the Metro South region. So we visited our physical therapy team and our audiology team to recognize the 2 awards that they got for Best Physical Therapy, Best Hearing Aid Center, and Best Audiologist. And we also visited our Center for Weight Control to recognize them for the Best Weight Loss Center Award through the Best of the Best contest. So we've had some exciting things happening here at Morton Hospital. We're doing a lot of great things with our staff. And again, we are looking to grow our team. So if you missed our hiring event, there's still time to sign up. Go to jobs.steward.org and check out what we have available. That's all the time we have for today, so thank you so much for joining us. We hope you enjoyed listening, and we'll look forward to joining you again next week for more Morton in the Morning. Reach out to us anytime at mortoninthemorning@steward.org. From all of us at Morton Hospital, we hope you have a happy and healthy week. Morton Hospital's nationally accredited Center for Weight Control has grown with the addition of Dr. Deepthi De Silva, our new Director of Medical Weight Loss Management. Our center now offers high-quality medical and surgical weight loss options close to home, with medical weight loss appointments now available in Taunton and Middleborough. To learn if you qualify for weight loss surgery or medical weight loss and to schedule a consultation, call our Center for Weight Control at 508-301-2434.